Good evening, everybody. I'm Sayukta from beautiful Spotless Skin team. I'm sure all of you must be keeping good health. Hair is one of the most individually unique, expressive part of our bodies. But hair care might be difficult sometimes. That may lead to various issues. Oily scalp with greasy hair, severe dandruff, and itchiness are the most common hair problems you can experience, especially during monsoon. If not taken properly cared, then it may weaken your hair roots and cause severe hair loss with patchy scalp conditions, also known as monsoon hair fall. So, knowing about hair care from an expert is essential. For this, today we have Dr. Vimala Manne, a consultant dermatologist from Hyderabad, live with us to educate us more on hair care in monsoon. Dr. Vimla has done her MBBS graduation from Gandhi Medical College and MD Dermatology from prestigious Osmania Medical College. She has done her observership in St. John's Hospital, Bangalore, in cosmetology, laser, and trichology. She has gained experience and expertise in the fields of dermatology, cosmetology, laser, and trichology, working as a consultant to various organizations, like from 2007 in Kaya Skin Clinic, Care Hospital, Nampalli, trainer to dermatologist in Oliva Skin Clinic, medical head of chain of La Belle Medispas. Now she is the medical director of Dr. Vimla's Skin, Hair and Laser Center, which has branches at Gochiboli and Mehdibatnam. She has a vast experience in this field and is in this field for last 14 years. Today, Dr. Vimala Manne will share with us each and everything on hair care during monsoon. A very warm welcome to you, Dr. Vimala. Hope you're doing good, ma'am.
Yeah, thank you so much for those kind words and a wonderful introduction.
It's a pleasure.
To you and all the viewers. It's happy to share my knowledge and experience and actually clear all your doubts.
We are really looking forward to a very informative and happening session, doctor. And to start with, because today we are talking about hair care during monsoon. What are the hair problems that, occurs during monsoon season?
Basically, the dryness of the scalp increases for some people. It may become little itchy, and people who already have an oily, greasy scalp, because the hair doesn't dry easily in rainy season, they don't take frequently shower, a head bath daily. So because of that, again, the sebum or the oil secretions in the scalp increases, and the yeast, which is actually incriminated in causing dandruff, that increases. It thrives well in an oily scalp, and it becomes itchy and sensitive. So mostly either it is because of a dry scalp or it's because of an extremely oily scalp where the sebum is not washed because of the weather conditions.
Right. So we experience a lot of, hair fall, especially during monsoon. We'll have frizzy, dry hairs. And of course, as you said, we have dry scalp and, wet hairs, of course, adding to all the problems. Now, why it is more important to take care of hair, especially during monsoons?
Monsoons, you have to take special care for hair. One thing, as I said, because of the weather, climatic conditions, hair doesn't dry easily. So people tend to neglect and don't wash their hair frequently. Because of this, most of the people travel outside, and we know the level of environmental pollution nowadays. So once also in a day, if you travel and come out inside the house, you're carrying a lot of dirt, grease, the smoke particles, the carbon particles along with you. So because of that, the scalp becomes more dirty, greasy, and favorable for the various yeasts and fungi to grow on the scalp. So because of this condition, the scalp becomes itchy or it becomes sensitive. That is the reason I think we should take special care in winter. Second, we drink in rainy season. And secondly, we drink less water in rainy season. Okay, again, because of that, the hair becomes little dry. This already who have existing dry hair, the dry hair problems will further increase.
Okay. One more question that is, that everyone keeps asking is, Should we need to wash our hair every day? See, we understand that keeping our scalp hygienic and clean is very important. But then, how often should we wash our hair?
Ideally, a person who is working and traveling every day, stepping outside of the house, you should wash your hair daily. Most of us do the mistake of washing your face even twice a day or thrice a day, just because it's visible to yourself in the mirror and to everybody outside. But the scalp becomes 10 times more dirtier and greasier than the face every day. But just because the scalp is not visible to everybody, we tend to neglect it.
Yes, yes. We know how important it is to wash our face or hands, etc. Because it's visible, as you said, we do that. But then when it comes to our scalp, because it's not that much visible, we tend to, kind of avoid or ignore it, which is not a good habit. Now, doctor, from you, we would like to understand and know about a good hair care routine, especially for monsoon season.
So generally, we have to go by which kind of a scalp and hair a particular individual has. We cannot monopolize and say that a single kind of shampoo or a single kind of a conditioner or whatever it is suitable for everybody. Ideally, every day we should wash our hair, especially those who travel every day outside from home to work, and whether it's for colleges, schools, or whatever it is. So basically, everyday cleansing is very important. You can use a mild cleanser, mild shampoo, or a mild Sinded bar to wash your hair. Nowadays, we are getting very mild shampoos where the surfactant is very, very mild, so that the grease and the bacteria, the yeast and all are removed, but at the same time, the hair shafts don't dry. Okay, so such kind of shampoos are available, because previously, if we would take a head bath daily, then the hair becomes extremely dry and unmanageable actually. But nowadays, that has been countered by using mild shampoos, like the surfactants, as I said, sulfate-free shampoos which are available, and which has the pH of the hair. So the same pH as hair and the scalp and the skin. 5.5 pH shampoos are available, which are very good even if you're washing your hair daily, everyday basis. So once you wash your hair daily, you can use a conditioner. Conditioner should never be applied on the scalp. It has to be applied only on the hair shafts. And keep it for a couple of minutes and rinse it off thoroughly. I'm talking about leave-on conditioners. So for a general person who has a normal scalp and normal hair, when I say it's normal, it means non-itchy and no dandruff, no other issues. Everyday cleansing with a mild sulfate-free shampoo or a mild surfactant-containing shampoo, and rinsing it off with plenty of water rather than using different kinds of shampoo. Not washing the shampoo off your scalp is much more problematic. So use plenty of water to rinse it off thoroughly. Use a conditioner if your hair is dry. It should be a rinse off conditioner if it is normal hair, but if it's extremely dry hair, then you can use a leave-on conditioner where you apply the conditioner on the wet hair only to the hair shafts and just leave it without rinsing. So these are leave-on conditioners. It depends on the texture of the hair. Like curly hair people or unmanageable hair people or dry hair you can use the conditioners, the leave-on conditioners instead of rinse-off conditioners. Don't use a hair dryer as much as possible. Let it just air dry. I'm saying air, AIR, so air dry. So not drying with the hair dryer. So just air dry. But if you're a person who has no time, you work in the media, immediately you need to, the hair should be immediately dry and manageable, then you can use the hair dryer, but 15 centimeters away from the scalp and only in the cold. You should never use it in the heat mode, which will damage the hair cuticle.
Yeah, because many times, especially during this monsoon season, what happens? It takes a lot of time to dry or naturally dry our hair. Because towel dry doesn't go much for that, and naturally because the sun is not there mostly. So yeah, definitely we get to use a blower, but then we should use it in the cold mode with the cold air. Okay, and doctor, dandruff again, as you said, is a very common problem during monsoon, without monsoon as well. I mean, dandruff is one big concern for most of the people in this country. How to tackle that?
So basically, dandruff is a very broad term. We have different kinds of dandruffs. Let's talk about the most common one. The most common type of dandruff occurs in adolescents and young adults. Because in this condition, what happens? The hormones are very active. Because the hormones are very active, what happens? The oil gland activity, the sebaceous gland activity increases. So because of the secretion of this sebum, the scalp becomes very oily and the skin becomes very oily in adolescent age people. And this is very much favorable for the growth of this yeast, which causes dandruff. So oily, greasy scalp is actually favorable for its growth. On top of that, at this age, they eat a lot of oily, fatty foods, and they drink less water, they sleep late at night, and they don't take a head wash daily. All this, increases or aggravates the problem of dandruff in the adolescents, which is the most common form of dandruff. Next is the dry scalp condition, where the skin is extremely dry. It's seen in mostly allergic, sensitive skin and atopic skin people. And what happens in this is basically the dry, sensitive people who have this dry scalp, they'll have a lot of itching as well. Okay, so though both are dandruff, for one, oil application is a no-no. For those adolescent, I'm talking about dandruff caused by the yeast, which is actually called Malassezia furfur. Another dandruff is where you have to apply oil, because the scalp itself is very dry and flaky because of the lack of the natural moisturizing factors in it. So both are diametrically opposite, and the treatments are also opposite. And many people get confused with both these. So the commonest is the adolescent type of dandruff, which increases up to 25 years of age, right from 14, or nowadays even at 11 years age, we are seeing that in the younger adults.
Doctor, as you mentioned oil on the scalp, and you actually made it clear that when oiling is important, when it's not. But with us in our society, we have this age-old tradition on applying oil on our scalp. People, leave the oil on our scalp for a number of hours. They'll sleep with it. They'll go out with it. So what is the right thing? Because many times people are not aware whether they have a very dry scalp or the dandruff is actually causing because of the oil. So how should we actually use oil on our scalp?
Oil application for hair is absolutely not necessarily in the present day conditions or scenarios actually. Previously, we all used to wash our hairs with sikakai, with the soap nut. Our grandmothers and everybody used to use we used to soak those soap nuts in water and then make a shampoo ourselves with that soap nut and then foam our hairs. So these are very good cleansers basically, but they dry the hairs and the cuticle gets damaged. So the hair becomes unmanageable. That is the reason they never used to wash hair daily. When we used to do, it was a Sunday rejaing, Every Sunday we wash our hair, and the rest of the day we don't wash our hair, because these soap nuts and shikakai themselves are strong cleansers. Secondly, there was not so much of pollution outside. Women never used to travel so much. So the issue of, greasy scalps, dandruff and all was not there. So even if we apply oil and go outside, the hair would be absolutely fine. But for the present scenario, if you just apply oil and go out, we will attract a lot of environmental pollutants and it becomes more greasy, and the damage to the scalp and hair is much more. So oil is basically a very good conditioner. It doesn't help in hair growth. So it's just a myth that people who don't apply oil will lose hair quickly. That's what we've been hearing from our parents and from our grandparents from so many years and generations together. But the kind of rinser, the cleansers they used to use, like soap nut, no pollution, and that kind of environment they grew up, and people never used to travel so much. There was no dust pollution. So the need and necessity of shampooing daily or using such oils and all, there's a daily use. was
Right.
okay with the face. It was appropriate for that kind of generation and environment and the times, the good old times, I should say. They were really good times. And now it's because an era where there's a lot of pollutants, pollution. I mean, you just go out into the traffic, you know how much you touch your face. Once you come out and you see, you can actually see that, you know, when you wash your face in the white sea, dirty water, you know.
Yeah. And you comb your fingers in your head and you'll get, you know, black nails.
You can actually, if you just scratch it with your nail, you can see the grime, dirt, and the black thing, you know, it's actually underneath your nails, nail plates. So that kind of dirt and pollution outside. And it's a strict no for oil application and going outside these days. So if you want to apply oil, you can apply it daily, alternate days or weekends, but then you have to apply only to the hair shafts, not to the scalp. So the shafts, it will actually restore the cuticle and make, it gives a conditioning effect, basically, the shiny look and manageable hair. So don't apply oil to your scalp, especially in that age group from 12 to 25 years of age. You can, whichever oil you want, you can apply, but most of the studies which say are in favor of coconut oil. Though the badam oil, you know, your almond oil, all these expensive fancy oils are available in the market. You should remember, they're all good conditioners. They do not play a major role in hair growth, and you can use whichever you want to use. Some documented evidence is there only for coconut oil application. And the second thing is, if you have an extremely dry and frizzy hair, that's when you have to keep it overnight. Otherwise, 1 hour or 2 hours before your head bath, it is sufficient. Okay.
Okay. Right. So no need to make a hole in the pocket to buy, you know, these fancy oils. Coconut oil is good enough. That too, only if you have very dry, then you can keep it.
For regularly also you can use, but you use it only to the hair shafts. So I say usually 2 inches away from your scalp. So that becomes very easy for women to apply, but it becomes a little difficult for a male to apply. And
right. So not on the scalp.
And men have much more of these dandruff. Okay, so that is the problem. Men have much more of this dandruff.
Okay,
and they all the parents, everybody insists when there's dandruff, apply more oil. It's a vicious cycle. They keep applying more oil. The dandruff increases further. The itchy scalp increases further.
Yeah, to, you know, break that vicious cycle, you need to actually stop using so much of oil on your scalp and use it wisely. Doctor, another thing that is again very common and everyday thing for all of us, and that's hair fall. Now the thing is, every day we do shed, you know, some amount of hair, but we don't know what is normal and when to be concerned. Another thing is that during monsoon, again, the hair fall is more than what it was during summer, etc. So how to prevent that hair fall? What is normal? When we should be concerned? Please guide us on that.
See, ideally, hair fall is a sign of life. So only for a dead body, the hair will not fall, actually. As long as you are alive and living, every 2 strands of hair has to fall. So when people expect after treatment that there is improvement and still the hair is falling, then you should be happy that you're still alive.
Good point to counter that, yeah.
So basically, even up to 50 strands, for some people, even 100 strands per day, we say is normal. Why? Because hair has a cycle. So there is a growing phase. You know, there is a phase where the stage is dormant, where there's no growth of the hair follicle. It is just like that. And then there is a phase shedding hair. Okay. So these 3 different phases of hair, we mostly we call it as, you know, the anagen phase and the catagen phase and the telogen phase. So these kind of cycles for every hair has to go through, you know. So at the time of this shedding hair, it is common that the hair keeps shedding, but same amount of hair should grow. So the problem is the number of hairs growing is much, much more than the, shedding. The number of hair shedding is much, much more than the number of hair growing. That's when the problem happens. So pretty much every day, losing a couple of hairs, don't get panicky, even if it's up to 50 to 100 hairs, but if you're getting back, your volume is good enough. So you don't feel that the volume loss is much, the size of your ponytail has not reduced, then it's fine. is absolutely fine. And shedding whenever you take a head bath is again fine. And another problem is some people feel that while taking head bath or a shower, the hair loss is much more. So they stop taking a head bath daily and they make it a weekend ritual. Then every day, which is supposed to, the hair which has supposed to be shed, they will all together shed on every Sundays. So if every day you were losing 10 hairs, then you will see on a Sunday, you will lose all those 70 hairs together.
Right.
That doesn't make a huge difference. So it's not because you're showering or taking a head bath, but those hair which have to be shed. I always tell people, on a plant there are many leaves. So unless the dry leaves fall, you can't expect fresh leaves from the same place. So it's the same way. It's the same thing. So don't panic if you're losing hair, but they have to grow back healthily, same diameter, same density, and your volume should be same.
Okay. And why that during monsoon we tend to shed more hairs?
Ideally, seasonally, sometimes we do shed hair. As I said, there's so many things: cyclical growth, seasonal, environmental factors, nutritional and stress induced. So, and last but not the least, the hormonal causes for hair loss and hair shedding. So there's so many causes. In monsoon, some people may have seasonal shedding, and as I said, wet hair, hair loss is much more on wet hair than cold hair. Electrostatic forces are much weaker between the strands. So whenever you comb on wet hair also, the hair loss is more. Okay. So many people don't know that because they feel that they can detangle the hairs easily when the hair is wet and it doesn't pain much. So we all do the same mistake of combing on wet hair so that the hair easily gets detangled. But then the hair loss is much more because the electrostatic forces are much weaker. That is why we should use a conditioner so that even after the hair dries completely and then you comb your hair, the hair doesn't get entangled. Okay, otherwise the hair is bound to get tangled. So when in rainy season, the hair gets wet multiple times and multiple times we keep combing our hair, rubbing, scrubbing our hair to dry it quicker, using hair dryer multiple times compared to the normal summers or winters. All this makes sure that shedding is much more.
Okay, so we get your point now. And doctor, people are also worried about their split ends. Many people think that, split ends will actually stop their hair from growing lengthwise. And again, during monsoon, because we have those frizzy, dry hairs, so split ends are more visible. How to tackle them?
So split ends, once they occur, obviously longitudinally, the shaft breakage can increase. So that is the reason, ideally, people who have more of these split ends, every couple of months, they should get those cut. Okay, so split ends should be trimmed regularly. Such people who have split ends, a leave-on conditioner is always better than the rinse-off conditioner. People who have few split ends, rinse-off conditioner is okay. So conditioner, as I said, entire shafts, use it 2 inches away from the scalp or wet hair, keep it for 5 minutes, rinse it off thoroughly. Don't comb on wet hair, let the hair dry completely and then comb. This is how you have to follow. As I said, coconut oil is also a good conditioner. So people who have these split ends, they can use coconut oil. People who have dry hair, even on the scalp, but because of dandruff, they cannot apply oil on the scalp. Such people can use aloe vera gel on the scalp just 1 hour before head bath and then wash their hair. So dry hair and the split ends and all, these for all these remedies work. Whether it's aloe vera gel, whether it is your good conditioners, we have very good medicated conditioners now available in the market, which has the goodness of both the chemicals in the herbal products, the fruit extracts, and even vegetable extracts. So meet a dermatologist or trichologist once, consult, find out what kind of scalp hair you have, and then go ahead with the products, because once they prescribe you the right products, lifelong you can use the same products. There's not going to be an issue. But going to the right person, because again, I want to insist, the dermatologists are the true trichologists. So there are many people publicizing themselves as trichologists and so-called cosmetologists, right from the cracks and different other specialities of doctors and non-doctors. So I would just want to warn the people not to go into the wrong hands.
Right. And is there any way, doctor, to repair the damaged hair without cutting them all off?
See, repair of, well, when you say damage, what kind of damage? The damage can occur because of your bad practices. You're
Right.
using your hair dryers in high noon, the hair straighteners. Nowadays, people use all kind of parlor activities at home self also, and in the parlors also, ironing and all. So all these will actually break the bonds between the hair keratin filaments, and then the damage of shafts occur. So we are all born with certain kind of patterns of hair. Some have wavy hair, some have curly hair, some have straight hairs. By doing such procedures and parlor activities, you're forcing these bonds to break and then reform. The reformed bonds between these keratin filaments will not be as strong as your original ones. So most of the patients or the people who come to me, they complain that after they got their ironing done or perming done or curling done, after that the hair loss started, and since then for 2 to 3 months the hair is breaking, or the hair shedding is much more. And so you have to keep it in mind that when you do such parlor cosmetics, hair cosmetic procedures, will they actually benefit your hair, or they are going to damage the hair? So this kind of damage, once it is done once or twice, then it is easily repairable. But it has been done for over the periods of years, then I can't say that it is irreversible by the doctor or a trichologist or a dermatologist. So it can become irreversible if you've gone to, abused your hair to such an extent.
Yes,
So
and nowadays, nobody keeps their hair virgin. They'll either get it colored or rebounded or, keratin treatment, etc. So many treatments are there. Saloon-based treatments. I mean, we should not call them treatment, but that's what they are commonly called. So, and end up losing the volume, etc., as you said. And doctor, does our diet or does what we are eating or intaking have a relationship with the quality of hair?
definitely, in fact, 80% of it depends on the quality of food we have and the lifestyle we are living, actually. So
Okay.
all the hair products, prescribed by the dermatologist or trichologist and all, plays only a minor role. The major role definitely is your lifestyle. So a lot of salads, sprouts, fruits, especially those which are colored fruits and vegetables and your greens, are rich in vitamins and minerals. And
Right.
these really help in the hair, to look more healthy, and more shiny. In hair growth, iron plays a major role. So many people think that whatever we eat, it's sufficient, because the levels, when we doctor, we yearly get a checkup done for vitamins and all are in the normal range. But what is normal for the body in the blood is not normal for your skin and hair. For skin and for the body, the skin and the hair are useless organs. So whatever we eat goes to all the organs of the body. Anything remains goes to skin, and then anything remains goes to hair. That is the order of preference. So whatever the parameters they're giving in the lab reports are not for your hair and not for your particular age. Okay. So even if the reports are normal, a dermatologist and a trichologist should see the reports and then give you the supplements if you have nutritional deficiencies. But eating a balanced diet which contains dry fruits, your protein, salads, sprouts, a lot of curry leaves is excellent for hair growth, a lot of vitamins and minerals in it, a cup of curd daily, and 2 seasonal fruits rather than fruit juices, because you just don't want your sugar levels to go. You want all the good things in the pulp of the fruit as well. So 2 seasonal fruits daily, all this. And if you're a non-vegetarian, just like an apple a day keeps the doctor away, an egg a day is always good for the hair. Okay, so a boiled egg gravy you can have, unless you have cholesterol or any other issues. Please don't take out the yellow, because I see so many of the youngsters, children being deprived of the egg yolk, saying that it is fat. But all the fat soluble vitamins which are required for hair are there in egg yolk. So please, for children and for healthy individuals don't skip having your egg yolk. Only if you have cholesterol, diabetes, or hypertension is when you have to skip your egg yolks. Okay, and you can have chicken, fish, all these protein diets, but the way you cook it makes it makes a huge difference. Not a deep fried one, but a grilled or a steamed one, so that the protein portion is increased and the fat portion is less. So drink lots of water and exercise regularly, because obesity itself causes thinning.
Okay, so very healthy and balanced diet is what will keep our hair healthy. Now the thing is, doctor, as nowadays, people do or try a lot of diet where, a long time fasting is involved, a diet where carbs are completely omitted from your thali. What's your take on those?
See, these are helpful for losing weight very quickly in a short duration of time.
Mm-hmm.
After they do this kind of diet, immediately they don't see hair fall, but 3 months post such diet, the hair fall is severe, because when all the vitamins and nutrients in the body are reduced, the body will give preference, as I said, to the major organs, and it will completely stop sending anything to the hair. So what happens, whatever was stored in the other organs will get utilized by the end of 3 months post this fasting episodes which you've done over a period of time, and then the shedding starts. That is why, whether it is after 3 months after delivery or 3 months after you suffered a severe illness, whether it's malaria, typhoid, anything, there'll be severe hair loss, because all the nutrients, vitamins are depleted in the body. They're not replenished by your intake or by your supplements which you should have taken, and the body will stop and refuse to send any further hair follicles.
Okay. We'll also take some of our viewers' questions, Doctor. Akash Singh is asking, what type of lifestyle changes to be done for skin or hair during this season?
See, ideally, in rainy season, we tend to drink less of water, which is not good. You have to keep the same amount of water you have to drink. Drink lukewarm if you don't want to drink cold water or normal water. So keep the skin, that keeps your skin and hair both hydrated and more manageable. So drink lots of water. Lot of, again, fruits we tend to neglect because it's again cold and you don't want to eat all hot, spicy food. So you tend to go eat michi bhaji and KFCs and all kinds of stuff. But none of these are going to help your skin and hair. Okay. So you are supposed to have fruits, and it is again a myth that vitamin C and fruits in rainy season will cause cold, cough, and fever. Mm-hmm. Okay, actually the vitamin C improves your immunity. So having fruits is really good. But I don't suggest you actually take out from the refrigerator and have something cold. You can always keep it outside. Your in the morning only prepare yourself. The night take it out from the fridge and keep it in.
Right.
You can have. So there's always a way if there's a will. Okay. So so definitely you will have to continue eating seasonal fruits. If you want to eat something little more spicy, you can make nice spicy sprouts. So that is your protein diet, which will actually help. As I said, steamed chicken, fish, skinless is really good for hair growth. So people who love non-veg and swear to eat only non-veg can eat those, or can eat sizzlers. And if you have to have something outside also, you can always have something which is grilled or steamed rather than deep fried. So it's not that you're stopping, those kinds of food, you're eating it in a little healthier way. Yes. So eat all these, lots of water and exercise regularly. That's the key point, because obesity, as I said, increases insulin resistance. And then though the sugar levels are high and the nutrient levels are high in the body, they are not utilized by your hair follicles if that happens. So
you have explained it so well, yes.
Okay, so that kind of a thing.
And Dr. Trupti Pandey is here asking, which vitamin is best for hair, ma'am?
Okay, if you ask which vitamin, there is no single vitamin which is actually important for hair. There are multiple macronutrients, micronutrients, so many things, vitamins and minerals, and your protein, which is important. Mm-hmm. But if you ask me, most important, these are all important. Most important is your iron. Most important is your iron and your protein. Okay, so these are the two things which are absolutely necessary, along with all the micro and macronutrients, because each one plays a different role. Okay, like whether it is your vitamin D deficiency will cause hair fall. If it's vitamin B12 deficiency, there's premature graying of hair and again hair fall. Okay, so all the methionine containing, sulfur containing amino acids deficiency will again cause the hair to become very weak and fragile. The color changes may also occur. So there's so many things where that is the reason why we insist on balanced diet. You can't just live on pills and pop medicines all your life. And that is the reason we call them as supplements and not replacement to a healthy balanced diet.
Right. So, it's important to have a very healthy, balanced, diet. And I would like to add to that, doctor, to this question that many a times, because people, now understand that if I'm shedding more hairs, that means I have deficiency, I have iron deficiency. They'll assume by themselves without even getting a blood test or, actually a test where it's confirmed that they have such deficiencies, or they'll start taking biotin supplements. How good or bad this practice can be?
See, I always say half knowledge is always dangerous. So either you have complete thorough knowledge on that, or you don't have knowledge. It's fine. Then you will acknowledge the fact that you don't have enough knowledge, and you will ask the person who is actually the expert in that particular field. But this half knowledge, what happens? You will take things for granted. One thing, and you will actually implement the wrong things. Okay. So biotin deficiency does not occur as much in Indians, as much in it occurs in Caucasians and foreigners, because biotin is there in raw leafy vegetables. Okay, so since we sprinkle a lot of curry leaves, pudina, and your coriander, kothmir, right, which is popularly called as dhania leaves, which is called as. So these all are rich sources of biotin. So most of the Indians who consume a lot of these green leafy vegetables, as well as these, the coriander or pudina and curry leaves and all, we usually don't have severe biotin deficiency. But eating these raw habit is not there in foreigners and Caucasians. They tend to have a lot of biotin deficiency. So initially, all the people used to consume biotin deficiency, but you cannot say that all kinds of genes are same, all kinds of people across the nations, countries are same. So our requirements, our food habits are different. We Indians are much more deficient in iron. Okay, whether it is our lifestyle, food habits, and women, because they neglect their own food and diet, catering to the family, and we are menstruating cycles, we have all these causes a lot of deficiencies, and then we have kids, we conceive, we lose blood, so many things. So basically, many people get a hemoglobin test, a complete blood picture, and they see that the hemoglobin is fine and the hair is fine. Complete blood picture or hemoglobin will never show you the iron which is actually adequate for hair. So even if you have absolutely normal hemoglobin, the hair loss can severely happen because of severe iron deficiency still. So the dermatologist will give you a series of tests, and then those levels of tests have to be done. Okay, and according to your age, whether the limits are normal or not, and then we have to give iron supplementation. So most important, as I said, is definitely iron, B12, D, and your proteins.
Right. So the bottom line is that don't do any self-medication. Go and consult your doctor, a dermatologist or trachologist in this case, and they'll suggest you what's best for you. And doctor, as we are, at the verge of summing up the whole session, anything that we missed that is important to our viewers to know as, takeaway message, anything that you would like to share?
Yeah, another thing in hair, I would want to say the hormonal imbalances, which is of late on the rise. Baldness, the male pattern hair loss, which is increasing of late. We see even in 20 years going bald nowadays. In women, we see thinning of hair at a much younger age, the partition widening, and then the scalp is visible in between the hairs. Okay, that kind of thinning of hair is happening. And all these are hormonal hair losses. And again, that is all because of bad lifestyle. Obesity, lack of exercise, drinking less water, not eating on time, not sleeping on time, consuming a lot of junk food, and stress are the major causes for hormonal imbalances. which is causing this kind of thinning of hair. Most importantly, the thyroid is one cause, the PCOS, polycystic ovarian syndrome, where people have acne, obesity, facial hair growth, and thinning on the front half of the scalp. All this are because of bad lifestyle. So rather than just popping in pills and searching the internet and doing so many things, instead of applying curry the curry leaves juice, onion juice, all these kind of things, consume what is healthy rather than applying. Eat curry leaves, take curd rather than applying curd. What is all healthy, which has to be consumed, are all applied to the hair and not consumed enough. So there's no point. So eat what is right, have a balanced diet, exercise, avoid junk food and stress. If possible, incorporate meditation into your daily lifestyle. Okay, because stress-induced hair loss, no dermatologists and trichologists cannot help. And please go to the right person for the treatment. That is again a request, because your skin and hair are precious. And if your internal health is not good, it is reflected in your skin and hair. So whatever you apply, do, or, even if you are a diabetic or you have a hole in the heart, nobody will know unless you reveal it. But if you have any problems on skin and hair, it's there in front of everybody, to see and criticize. So that's it for today.
Thank you so very much, Dr. Vimala Manne, for your valuable time, ma'am. It has been a very informative session for our viewers, and it was really great to hear you. We really look forward for many more such sessions for our viewers in coming times. Thank you so very much.
Thank you so much. Wonderful anchoring. I want to congratulate you for a lovely questionnaire today, and I hope all the viewers, I catered to an answer to all your questions. And if you have any issues where you can't deal with your hair or skin, you're welcome to our branches, Dr. Vimala Skin, Hair and Laser Centers, both in Gachibowli and Mehdipatam at Hyderabad. Thank you so much.
Thank you. Coming from you, it's a huge compliment. So thank you once again. And viewers, yes, if you want to consult Dr. Vimala Manne, you can visit for Raidurg Center, Dr. Vimala's Skin, Hair and Laser Center, 301 Apurupa near Whisper Valley, Sheikpet Dargah to Gachibowli Main Road. Raidurg is the address, Hyderabad, Telangana. And the phone numbers are 9100383838 and 720-710-3838. And for the Mehdipatam Center, Dr. Vimala Skin, Hair and Laser Center, opposite MP Garden Function Hall, Amba Theatre Road, Mehdipatam, Hyderabad, Telangana again. And the numbers are 9100373737 and 04066848565. And for more details, you can visit on www.drvimlaskinhair.com. Stay connected to our beautiful Spotless Skin page. Thank you. Goodbye. Have a good day.
Have a good day.